Here we go.
I'm waiting on Susan.
Oh,
She's
I'm waiting on you.
What are you
We're
supposed to say,
live.
Susan?
We're live. Hello, viewing audience. Pop Barnes Health and Community Tips for the week. We're here every Monday morning. We've only taken 2 times off. Andrea said we weren't working hard enough, so we better take some respite time, some respite
Yes.
care, she said. But only 2 weeks. She's a regular slave driver. But in any event, Pop Barnes Health and Community Tip for the week here. The purpose of this program, as always, is to give you enough health information that you can choose to live a healthy lifestyle, or be in a position where you can make informed healthcare decisions. Now, I have Miss Marie Peterson Barnes here. I want to tell you a little bit. I heard all this talk years ago, Tai Chi, Tai Chi, Tai Chi. So I decided to take the course. I have generalized arthritis, which means that you have a choice. You can take all the ibuprofen for inflammation, or you can do as I do, because I realize as a nurse that exercise is the one thing. You're still going to have the pain in the joints, but after a while, you strengthen those ligaments and tendons or whatever, and the endorphins kick in. And after about 15 to 20 minutes, I feel like Chuck Norris, my hero. And so I took a Tai Chi course, and the Tai Chi course works. And so I use Tai Chi for 15 minutes prior to my exercise every day. And then I also use Tai Chi for cool down. It works. It helps with your balance as well. As a senior citizen, yes, I have fallen. My wife has fallen. You have proprioceptors throughout your whole body. Tai Chi keeps those attuned. And so I have the pleasure to have Miss Marie Peterson Barnes here, no relation. I think her husband is distantly related because the Barnes clan is huge. And she is a certified Tai Chi instructor. So Marie, I'd like for you to just come a little bit to the camera so people can see you better. And you can tell them about yourself, and then you can show your slides too afterwards. So Marie, would you let everybody know something about you?
Yes. Thank you for allowing me to be a part of Health Community Tips for the Week. I am Marie Peterson Barnes with River Valley Regional Commission Area Agency on Aging, a certified Tai Chi instructor. Tai Chi is one of the most effective exercises for the health of mind and body. And its essential principles includes the integration of the mind with the body, the smoothness of the movements, mental concentration, and the control of breathing. If you are experiencing challenges that will prevent you from participating today, stop and contact your medical provider. Listen to your body. Continue only if you feel good. However, if you start to experience pain, shortness of breath, stop. Wear loose, comfortable clothing, as well as fitted, flat, comfortable shoes. So with that said, I'll show the slide.
And Marie is an excellent instructor because she is the one who taught me Tai Chi. And even though I'm a little bit slow on learning, in fact, they had me in the class. I wonder why they always had me in the back with that stool with that pointed hat. So it took me a while to catch on. She's a good teacher, and I can do all the movements and all like that now. So she's a very good instructor. And she's going to put something on the screen in just a little bit. And you see it says Tai Chi for arthritis is one of the most effective. Well, here, let's read about her. That's fine. She is a seated Tai Chi for arthritis instructor, Marie Peterson Barnes, and she's with the River Valley Regional Commission Area Agency on Aging, and organizations that I have partnered with for many years. And she's going to show us a little bit more about Tai Chi on the next slide. Tai Chi for arthritis is one of the most effective exercises for health of mind and body. No, Andrea Winston didn't write that. Marie Peterson Barnes did, because Andrea always talks about, and it's true, the mind-body connection.
So right.
So It's one of the best exercises for health of mind and body, and it has many benefits. It improves mental concentration, improves, help me with the other lines, Maria, with these 5-4, because I can't read them.
It improves mental concentration, improves muscle strength, improves flexibility. It helps prevent falls. It eases pain and stiffness, and it improves sleep.
And that is something
Wow.
I forgot to mention. It does definitely, and it does all those things, by the way. The stiffness that you feel in the morning, you do 5 minutes I do 15 minutes, and the stiffness is gone. And so I'm a living testament to the fact that Tai Chi works. And so, all right, Marie, you've got the baton in your hands right now, so you can get seated and let everybody know about Tai Chi.
Okay.
Look at Andrea, she's rocking side by side. She can't wait. She
I can't wait to get started.
I got my feet flat on the ground. I'm ready to go.
Thank you. Thank you, everyone. Remember, this is seated Tai Chi. So pull up a chair, relax, enjoy, have fun, and concentrate. Remember, as we grow older, it's important that we stimulate our minds. So a lot of these movements, they're done from memory. So concentrate. I'm a senior citizen as well, and I love being a senior citizen because I'd rather enjoy growing older than to die young. So let's have fun with these exercises today. We're going to start with the neck, then we'll move down to the shoulders, the spine, the knees, and then the ankles. And we'll do 2-3 sets of each portion of the body. So let's get started. First of all, let's do the greeting. Whenever we do the Tai Chi, Dr. Paul Lam has taught us about the greeting. The first one, lift up our right fist, that stands for strength. Then we pull up our hands, put the 4 fingers together, that stands for friendship. Put that thumb together, humility and respect. So we'll get started by moving those fingers, exercising those fingers to relieve the stiffness of arthritis. Remember, there's no cure for arthritis, but we can help lessen the pain by exercising, okay? So now we've completed moving those fingers. We're gonna start with the neck. If you can, and remember, you're working at your comfort level. You're only competing with yourself, no one else. You're working at your comfort level. When you get tired, please take a break, rest, and then come back and continue. Here we go. And if you can sit at the end of your chair, remember to sit at an upright position and to sit in a chair that has no wheels and no arms, okay? So ready? Body upright. And we're gonna start with this. Remember, we're exercising the neck first. Arms are very slow, very slow. This exercise is slow, smooth, and gentle. Now, turn your palms over, looking at your palms. Pretend you're pushing your chin back. Slow, smooth, and gentle. A gentle resistance. There you go. Very good. You got it. Then push out, slow, smooth, and gentle. Watching your fingers as you gently lower your neck. Breathe in, hands up again. Turn your palms over, breathe out. And pretend you're pushing your chin back. Slow, smooth, and gentle, gentle resistance. Push out as if you're pushing against air. Watching your fingers as you gently lower your neck. Let's do this once more. Hands up, slow, smooth, and gentle. Turn your fingers over, watching your palms, and pretend you're pushing that chin back. Slow, smooth, and gentle. Push out air as if you're pushing against air. Lower your neck gently as you're watching your fingers. Okay, still working the neck, hands up. Now lower your right hand. Lower your right hand. Turn your left hand over. You're watching your left fingers and you're gently turning your neck as you watch your fingers. We're still working the neck about 70 degrees or at your comfort level. So if this is painful, imagine yourself doing it and you still get the same results. Come back, come back. There you go. Now change hands. Push the opposite hand down. One hand is facing the floor and you're watching the other hand. Now we're working the opposite side. Still working the neck. And if you can go further, fine. If you can't, just pretend you're doing it. Slow, smooth, and gentle. Change hands again. Change hands again. Slow, smooth, and gentle. One hand, one palm faces the floor and you're watching. Very good. Come back. And we're doing once each side, okay? Change hands again. One hand faces the floor, and you're watching the opposite hand. Slow, smooth, and gentle. Last time, come back. Change hands. Watching the other hand. Very good. Very good. Now come back. Now, we've completed exercising the neck. Now we're going to go down to the shoulders. And we're going to rotate our shoulders 3 times forwards gently and 3 times back gently. Relax. Breathe in and breathe out. Rotate your shoulders. 1, 2, gently, and 3. Now we'll go back. Rotate 3 times backwards. 1, 2, and 3. So you're using those muscles that you rarely use. Now, pretend you're cuffed. Cuff your feet. Cuff both hands as if you're holding air. Hands are on each side of you. Now breathe in and pull that air out. Breathe in, pull that air out. Breathe out, dump that air out. Very good. Breathe in, pull that air out. And please try not to extend your arms too much. Should be a slight bend in your arms. And then out. One last time. Breathe in. And dump that air out. Breathe out. Very good. So now we've completed the neck and the shoulders. Now we're going down to the spine. And you'll feel this. It's simple, but you'll feel the effects of it. Grab that ball. Grab that imaginary ball. Everybody got that ball?
Yes, ma'am.
Facing. Now let's flip that ball. Flip that ball. Turn one hand up to the ceiling. And the opposite hand is pressing the floor. And you can feel the stretching in the spines. You can feel that. And should be a slight bend in your arms. Come back with that ball. Bring that ball back. Flip that ball over again. And the opposite side. And one hand is facing the ceiling. The opposite hand is facing the floor. Come back with that ball. Flip that ball over. And the opposite hand. Hand up to the ceiling. Palm is facing the floor. Bring that ball back. Flip that ball. One palm is facing the ceiling. The other hand is facing the floor. Bring that ball back. Flip that ball. Push that ceiling. Should be a slight bend in your elbows. Push that ceiling. Let's do it one last time. Flip that ball. Push that ceiling. push that ceiling and push the floor. Now don't let the ball go. Hold on to that ball. Hold on to the ball. Got the ball? Still holding that ball? Arms are facing. Now, if your top hand is facing, if your hand is on top, then you're moving that position first. If your left hand is on top, you move to the left first. My top hand is on the right, so I'm gonna move to my right. And remember when you're moving, not to go past your knee, because you can easily pull a muscle. So I'm gonna move right here to my knee, and I'm gonna flip that ball, okay? Now I'm gonna move to the opposite side, not past my knee, and palms are still facing. I'm gonna flip that ball. Palms are still facing, move to the opposite side, flip that ball. To the opposite side. And the way you get exercises, the way you get your workout on your leg when you're doing the seated exercise is that you're pushing down on the ball of your foot. If both of your hands are facing the top of your knee, then you're pushing down on the ball of your foot and the opposite leg opens. Okay? Now we're gonna put that ball, pushing down on the ball of your foot and the opposite leg opens. Put that ball over, change the opposite leg open, and you're pushing down on the ball of the opposite foot. And let's do it one more time. Put that ball over, pushing down on the ball of the foot, and the opposite leg open. Very good, very good, very good.
Marie?
Yes.
Marie, that is the one, because I have back problems. That is the one that really, that I have found out that the Tai Chi really helps with my thoracic and my lumbar areas. Just doing that, and because it's non-stress, but it increases the flexibility in that area.
And you can feel the difference. You can
feel the difference, yes.
Yes, you can, absolutely. So now we're going down to the hips, okay? So now, ball your fists shortly. And when you're doing your seated exercise and you start with the warm-ups and the stretches, because it's always important to do this before, no matter what exercises you're doing, it's always important to stretch. So ball your fist very gently, okay? And this is what we're gonna do. Now remember, if you can't pick your foot up, that's okay. Just imagine that you're doing it. If you're tired right now, just stop and take a breathing and come back, because we'll be here for a few more minutes, okay? Here we go. What I'm doing now, my fists are gently balled, and what I'm gonna do now, I'm gonna pick up my left foot. And what I do with my left foot, I do with the opposite hand. So I'm gonna pick up my left foot, and I'm gonna push out the ball of my foot, and the opposite hand comes out. And then I'm gonna bring it back, and now I'm gonna do the opposite side. Pick up that foot, come out with the ball, and then the opposite arm, okay? Come back, and believe it or not, that helps with your back too. Pick up the foot, push out, and the opposite arm. And remember, a bend should always be in your arm, okay? Pick up the foot, push out with the ball of your foot, and come back. Let's do it once more. Pick up the foot, push out with the ball of the foot with the heel, and then out with the opposite hand. Very good, very good. Now, when you wake up in the morning, you'll probably say, why am I so sore? You'll understand what you're doing today. We're using the muscles that we normally don't use, okay? Okay? So now we're still working these hips now. So now we're gonna position that hand up under the elbow. And both your palms are facing the wall, okay? And we're gonna push that imaginary wall, okay? And when we push that imaginary wall, the opposite foot opens, the opposite leg open. Because remember, if If you're sitting down exercises, we still want to exercise the whole body. That's important. So here we go. We're going to push down the ball of this foot where your hand is over that knee, and we're going to open that leg. Now push that imaginary wall. Push that imaginary, and you can feel it. You can feel it. Change hands, come back to the opposite side, slow, smooth, and gentle. Push that wall on the opposite side, and the opposite leg opens. Come back. Push down on the ball of the foot, pushing that imaginary wall, and open that opposite leg. Come back. Push and open that leg, the opposite leg. Very good. Good. Let's do it once more. Push and open that leg. And one thing about that exercise, you feel it in you feel it in all, if you have tension around your neck, you can feel it here, feel it in your back, and you're opening your legs, so you're still getting the full body workout with the legs. Okay? So now we've completed the neck, the shoulders, the spine, and the hips. Now we're going down to the knees, okay? Gently ball those fists together. Put your fist slightly to your side, and we're gonna pick the opposite, whatever, and it doesn't matter which side you start with, just work the same on each side, okay? So I'm gonna start with my left foot. I'm picking my left foot up, and I'm gonna push out with the ball. I'm working my knees now, and then out. Come back, do the opposite. Push up, and remember, you say, oh, it hurts me to pick my knees up. It's okay, just imagine you're doing it, and you'll get the same results. Up, push out. And if you continue to exercise, even if it's nothing but 10 minutes a day or 5 minutes a day, what's comfortable for you, you'll start to see the effects. You will start to see the effect. Opposite foot, pick out, and back. Pick out, opposite foot, push out with the ball, the heel of your foot, and out. And now, let's do it one more time. Up and out. And so now we're moving down to the ankles because time is running out. So we're moving down to the ankles, okay? Relax, hands by your hip, and we're gonna work the ankles now, okay? And remember, with what we just did with the knees, the only difference is I didn't kick out. We did with the ball of the foot. Next time, come out with a toe, okay? Just remember when you come out with the ball and you do your sets of those, then you go to the toe, you push out with the toe, and you can feel it. When you position that toe, you'll feel it. So now we're going down to the ankles, and we're gonna do heel, toe, heel, toe. We'll do each foot, and then we're gonna do big toe, little toe, okay? Here we go. Everybody ready? Let's do heel, toe, heel, toe, heel, toe. The opposite foot. Heel, toe, heel, toe, heel, toe. Now we're still working the ankle. Big toe, little toe, big toe, little toe. Opposite foot, and you can feel it in those ankles when you do that. Big toe, little toe, big toe, little toe. Very good. Have a shake. All right, have a shake. Very good. And those are our warm-up exercises for the day. And you can do those every day. You can do them as many times as you like. But it's so important. If you don't use your body, it will use you, and you will not like the way your body uses you if you don't use it. Thank you so much for having me.
And let me tell you, I can tell that Susan and I see Andrea, don't y'all feel different?
I do. It's amazing. My body feels so much lighter. My posture is better, and most of all, the tension that is Monday morning tension right there is gone. So I feel so much more relaxed. That is really amazing. And even in this rolling and rocking chair, we're still able to do it. So thank you so much.
And I saw you two were really into it too. But what is so interesting is that you can be seated and
Yes.
do it, and your body feels marvelous afterwards. And it doesn't stress any of your joints or whatever. And what is that saying that you said, Marie? Say the last part, what you said. If you don't what? Use your body?
Remember to use your body, because if you don't, your body will use you, and you will not like the way your body uses you.
That is exactly right.
Yes.
Now, would you mention to them about one of the things that helped me when I took the course was that you had handouts. If anyone wanted to get a handout, how would they contact you, and where would they come to?
If anyone would like a handout, you can contact me at the office. The number is 710A Front Avenue, Columbus, Georgia. And the telephone number is 706-256-2900. Just leave me a message if I can't get to the phone, and I'll print you some handouts. And remember, the handouts that you receive, they will be upright handouts, but it's the same that you're doing seated. It's the same thing.
And that's the really good thing about Tai Chi, because I know that many of some of our viewing audience may have ambulation problems.
Mm-hmm.
And so you can do the same exercises and get the same benefits from seated Tai Chi as you get from standing Tai Chi. And it does have the same mind-body connection, Andrea, that
Yes,
you
sir.
always talk about. And it does help with, and I forgot to mention, it does improve your sleep as well. And so it's a full package. Tai Chi is a full package. And so would you repeat again, Marie, where they will come if they want to get a handout?
If you're wanting any handouts related to Tai Chi for arthritis, you can contact River Valley Regional Commission at 706-256-2900. I'm Marie Peterson Barnes, or you can come by the office at River Valley Regional Commission, Area Agency on Aging, at 710A Front Avenue.
Well, Marie, this has been marvelous. You always give a marvelous class. I can attest to it. She has also done this on my TV program, Focus on Health.
Yes.
And Marie will be back on the 26th of July. So that gives all of y'all now. And look, somebody like me, I'm a slow learner. You can sit down, watch. Look, and Andrea knows that. She says, "Oh, and what a slow learner he is."
No,
And you can practice these exercises.
I disagree.
And you can practice these exercises in ample enough time, seated, and pass this on to your friends. Let them know about this program, Pop Barnes Health and Community Pros Tip Program, and also that on the 26th of July, that Marie will be back on. And I always like to say there are a number of organizations in this community. I worked at New Horizons Behavioral Health. I was the RN supervisor, outpatient clinic. And I realized all that New Horizons does in this community here. And not only in this community, in the other counties. Will you, Andrea, let our viewing audience know what services you provide in what counties?
Sure, Pops. We provide a full continuum of services for people that are experiencing behavioral health, addictive disease, or developmental delays. Our services range from group homes to outpatient clinics to day services programs. We have programs in the Muskogee County Jail because that's where a lot of our individuals are finding themselves. So we have too many to mention right now. And then also we provide all of these services are available to our individuals and our citizens that reside in Talbot County, Harris County, Muskogee County, Chattahoochee, Stewart, Clay, Quitman, and Randolph counties. So if anybody is needing any help or assistance, especially in the environment of COVID, we really embrace technology and allowing access to services. So if anybody is suffering or has a family member that's suffering, you don't have to continue to suffer alone. We are here for you, and this is what we do. So please reach out.
And my other community partner is Tree of Life Healthcare that provide free healthcare for individuals who have no insurance or if you are underinsured. So those are the two organizations that City Councilor Pop Barnes here, I have decided to partner with because of all that they provide to the community. They don't look at your pocketbook, they look at you. And now also at the same time, because they do so much in the community, I ask everyone, if you can't do anything but call them and volunteer time, that helps them perform their mission of helping you. And then of course, we know in today's world, nothing happens without those dead presidents on that green piece of paper. And so no matter what, and even a jingling, if it's a quarter, quarters add up to dollars, $1 add up to $2. And so you need to help the organizations that help you. And I'm not going to leave out the organization that Marie works for, River Valley Regional Commission, Area Agency on Aging. I use them to the max when it comes to anything dealing with seniors. It is a hidden treasure. I don't know why that many people do not know about the River Valley Regional Commission, but they do so much. Miss Katie Howard has been a mentor to me. Let me know where I can fit in and use my position to help the Area Agency on Aging, and it warms my heart to do that for the River Valley Regional Commission, for New Horizons Healthcare, Behavioral Health, and for Tree of Life. And so those organizations, you need to volunteer. River Valley needs volunteers as well. And so now we're going to see Marie on the 26th. Until then now, trust me, if you do those exercises that Marie showed you, you're going to feel like a different person. And also until next time, I always say, until the next time that I see you, please be good and kind to yourself. You know why? Because God loves you. Take care now. Bye-bye.
Bye, buddy. Thank you, Miss Marie.
Thank y'all for having
Thank
me.
you,
It was
Marie.
wonderful. Thank you so much.
Thank you. Bye.